Hi guys, my name is Hinal and welcome to my channel Physio Talk. Today's our topic is axillary nerve. So first of all we know about the nerve which transmit the impulses through the stimulation. Nerves are basically two types. First one is sensory and the second one is motor. So today's our topic is axillary nerve. Why it's called axillary nerve? Just because name itself suggests that axillary as it runs through the upper part of axilla and it's not supply any muscle there. So basically the axillary nerve not supply any muscle at the axilla, but it run through the axilla, so the name is axillary nerve. And the other name is circumflex nerve. So why it called circumflex? Just because it courses around the surgical neck of humerus to supply the deltoid muscle. Basically the axillary nerve is supplying two muscles. The first one is deltoid and the second one is teres minor. If we know about any nerve, first we know the root value of the nerve. So the root value of axillary nerve is ventral rami of C5-C6 segment of spinal cord. In the diagram, we see that C5-C6 ventral rami of spinal cord. So this is the axillary nerve. After the root value, we know about the course. So first of all, it is present at the axilla level. At the axilla, axillary nerve or circumflex nerve is the smaller terminal branch of posterior cord in brachial plexus. And we know that at the axilla level it not supply any muscle or any structure, and then it enters into quadrangular space. So we know about what is quadrangular space. The nerve passes backward to quadrangular space. Boundaries by the subscapularis muscle, below teres major, medially long head of triceps brachii, and laterally surgical neck of humerus. Right? Then it enters into surgical neck of humerus. We know that then it passes behind the surgical neck of humerus, where it divides into anterior and posterior division. So in the diagram we see the axillary nerve. Its root value is C5 and C6. This is the axillary nerve. Its articular branches at shoulder joint. Then it supplies two muscles, teres minor and deltoid. And then it also has a cutaneous branch, upper lateral cutaneous nerve of arm, and skin over lower half of the deltoid. Anatomy of the axillary nerve: loss of abduction beginning of 90 degree because it supply the deltoid muscle, and the second is sensory loss over lower half of deltoid.